Errol's stroke was an intracerebral hemorrhage, leading directly to the brain tissue. The severity of a hemorrhagic stroke is often more severe and more life-threatening than an ischemic stroke, which is caused by blood clots. Errol Lynch, one of the founding figures of Touch Tuina, a natural master of martial arts, Errol developed an instinctive understanding of how the body moves, how it functions, and how it heals. This passion became the pathway to his lifelong study of Tuina, a Chinese medical massage, and theory and practice of Chinese medicine. In 1998, a clinical visit to China introduced Errol to the ancient therapy. Over the years, he returned again and again, training with China's most respected doctors and professors, and forming close friendships with many of the nation's top medical masters, becoming one of the very few non-native practitioners invited to teach there. His work has been praised for bringing the benefits of Chinese medicine to audiences worldwide. Errol has brought that knowledge back to the United Kingdom, blending it with his own deep understanding of the body through his various martial arts trainings. His dedication was twofold: to teach the remarkable skill of Tuina to others, and to help people of all ages overcome pain and health challenges. Even now, through his own trials, Errol has carved new wisdom, showing that even in recovery, he is still teaching and lifting others from pain and disability. Since coming out of hospital, Errol was experiencing certain difficulties with the right side of his face. The muscles were weak and slightly flaccid. There were lines where the skin had lost its tone, and when gargling found he could not retain any water in his mouth. As well as his own self-massage, I performed various treatments, of course Tuina and other modalities, such as intraoral massage, tongue exercises, EMS stimulation, manual lymphatic drainage, kinesiology, and facial acupuncture. After several treatments, Errol was then able to retain water in his mouth and the muscles in his face.
To get a full understanding of the type of stroke I have, my condition was the whole right side of my body, my face, my voice, my ears, my eyes, my teeth, my throat, and my arms and legs also shut down. My lower legs are quite weak, and so I have to make it up the stairs quite a few times through the day. So I use the stairs as a tool to improve my walking through the hips and the knees and ankles. Now we're doing cold hot steams. This will also benefit the throat internally inside here, and also benefit the skin outside as well. Doing the hot steam therapy benefits us inside my mouth, softening the tissue of my throat and vocal cords. I also benefit the circulation of the skin. I can do treatments to benefit my arms and legs on a daily basis, but without treating the parts I've mentioned, the face, the teeth, the eyes, all those areas, the whole treatment will take a lot longer.
Yeah.
So you can open up.
Yeah. That's nice. At the moment, when you're walking, you're sort of sternly rotating a little bit to be able to get that foot through, right? Instead of driving the knee forwards. So I want you to work on when you're walking, thinking about that knee going straight up. Yeah, knee forward, that's it.
I'm a practitioner at Touch Tuina. My name is Angelika. The first treatment that I did was complement Mariana's treatment, and we have worked on the right side. The following treatment was on his affected arm. We were working on improving his range of movements. We acknowledged that involving the movement on his fingers affected the range of movement he could do, which was a big discovery for us again. So working on his neck as well, on his mid-back, shoulders, which felt really tight. It's been an experience to understand how hospital system works, reflecting on that, what they might need in order to help people in a situation like this when the stroke happened, and yeah, that was a great experience.
It's important to practice the walking technique and correct the angles of my foot. The right leg is the one that's damaged. Here, you can see I'm forcing the right leg to do a lot more work and taking much more of the body weight.
You see that you're quite able to hold them and put them in the right hole. Now, what I would like you to do, I'll show you. If you hold them in your hand, like that, I would like you to bring one in between your 3 fingers and put it back in. Yeah, keep trying. Getting there. Okay, well done.
When I walked the stairs, each section took me 2 to 3 minutes. Now I can do the whole staircase much faster in a faster time, showing the strength and stamina my body accumulates. Each day, I do a lot of exercising and strengthening and training for my upper body and my arms. I'm working with an oversized meditation bowl, and the purpose of this is to help my whole body and cells resonate at a certain frequency. What has been great is that we have clinics in York and London, and whilst I was in hospital, my students and practitioners from York also came down to treat me. Although I wasn't ready, I went to York to help out in the Health and Healing Festival. However, I was still able to get a lot of treatments whilst I was in York.
Hi, my name's Issie, and I'm senior practitioner at Tuina, London. At that time where I actually found out, I was in my clinic in Catford. Lena, the receptionist, and the clinic manager in Kentish Town called up, and she said, Errol's had a stroke. Different emotions, as you would imagine, that goes through your mind at the time. And then just drove straight up to the hospital. All what was going in my mind on the way there, one, I hope he's okay. Secondly, body moving as quick as possible. I was the first one there, funnily enough, with his family. But we were just treating his legs, especially the right one, at the time where he couldn't move it. I have actually dealt with stroke patients before, but the recovery I've seen Errol have is exponential.
Before, you're doing a nice big step on this one, and then you're doing a small step. Big step, small step. And I was saying take a bigger step with this leg. So you spend more time on your effective there.
For 6 weeks after the hospital period, I was offered a community physio from a young lady called Indigo. Once a week, she would look at my technique of walking, go through the process, and when someone goes through the process, scrutinizing what you do and how you do, and this helps you look at your technique and makes you look at yourself a lot closer. I had to perform some bloodletting of the hand to take down the swelling. I was offered an occupational therapist, which unfortunately was of no help. Not because she was no good, just that the hand could no longer work to what she requested. After taking down the swelling, I was able to move the hand in the correct manner.
My name is Dahl, practitioner at Touch Tuina and Pilates instructor. The main technique used on Errol is a pushing method called Tuina. This small action is used throughout his body across the muscle fibers to encourage and increase blood flow, together with rotation and traction.
My good friend and a fighter who I was training in the past, Arnold Orbitov, introduced me to Errol. I had a professional welterweight, and at the time we were struggling with certain injuries. Arnold thankfully introduced us to Errol, and Errol changed the game for us. I didn't actually know about Errol's stroke for a few months. He put it up on Facebook, and then as soon as I seen it, I tried to make contact to see if there's any way that I can help. So I sent Errol a message, and I came down to see him the following week. Ever since, we've been going for weekly walks. Errol's progress each week regarding his steps and the pace and everything, it's really inspiring. It's just given me a lot more energy in life, just to see how he's hit everything head on and making improvements. It's just very, very inspiring. Errol's a great man, and I'd love to be half the man that he is. Some people are helpers and some people are takers. Errol's definitely a helper, and he changed the game for us in so many different ways.
Errol training his legs to mobilise and become stronger. Errol uses the Zimmer frame as a training tool to stop bringing his body too far forward or backward. So he uses the Zimmer frame to frame his legs to allow his body to raise straight upwards in one easy motion.
I don't want anything at all, and that's your churches, so I go for 18. Cobra, assisted stretch. Cobra, assisted stretch. So you got loudness, you got speed, and you have to make sure you get some support. I had so many patients. I work from 10 in the morning till 5. Okay. Then I go on the road and do private patients. So I do private patients from 6 to 11. So probably also the reason why I had a stroke.
In May, Touch Tuina welcomed Clive Whittam of Ecology in Motion Gua Sha, who came to run one of his exclusive Gua Sha courses. For Errol Lynch, it was a perfect opportunity to challenge himself once again, to test his focus, his memory, and his stamina following a hemorrhagic stroke. The question was simple: could he keep up with the pace of learning? The answer was yes. Not only did he keep up, but he found himself supporting many of the students, guiding their stances and refining their techniques.
Hi, my name's Hazel. I'm a junior practitioner here at Touch Tuina. The reason we were doing Gua Sha on his arm is with his stroke, whereas he does not have as much circulation in that arm, and at that stage, little movement at all. And so the Gua Sha was specifically helping to improve that circulation. It's been really informative to work closely with Errol, not only treating him, but also going back and forth with what is working, what is not, him allowing us space to figure that out ourselves, but also giving us guidance.
Just 1 month later, in June, Touch Tuina's Mariana Arando led a Toxen course designed to upgrade and enhance the skills of the students and the practitioners. For Errol, the frequency-based benefits of this therapy offered vital support, helping to ease some of the ailments left by his stroke.
I don't need the chisel. I don't need the chisel.
Pressure-wise.
Kind of, because what I can feel is like a ridge here, so I'm kind of opening up the joint, so a little bit of angle there, and then a little bit angle against the bone up there to give a bit of separation as well.
Mariana demonstrated how freeing the carpal bones and the wrist could restore movement, giving Errol greater range and flexibility. Once again, he pushed himself to join the class, even taking part in the physical, hands-on practice. It was a powerful sign. Both mind and body were growing stronger, as Errol endured long days of study and training so soon after his hemorrhagic stroke.